Hey guys, Dr. Sarah here. I wanted to talk about low back pain today. Did you know that low back pain is the number one reason why people call into work? And a lot of people, when they come in for care for low back pain, it's after they've had a huge exacerbation and can hardly move. So I encourage people to try to prevent this from being the case. But I wanted to talk to you a little bit today about how all this happens. So we're going to come over to our chart here, and I'm going to show you first, these are the curves of our spine. So we have a nice curve that's supposed to be right here, and then we have another curve up here that's supposed to be a C-shaped curve this way, and then we have another C-shaped curve up here. So this is the ultimate stability force of our entire body. It supports our nervous system, it supports our bones, it supports all of the other structures. What happens, specifically when people are working at desks, they lose this curve first. This is the neck, right? So this curve straightens out and flattens out. What has to happen then is this curve will have to flatten out and this one will have to flatten out in order to compensate for everything that's going on upstream. So as we're sitting at our desks hunched over, we're placing a huge amount of pressure on all the muscles and ligaments, as you can see here, that are all right there. So as those curves get lost, all these muscles are put under strain and pressure. Now, one thing that low back pain specifically comes from is glute and hamstring muscles. These muscles, when they get tight, they act like a rope that just gets pulled down. And so that puts pressure on all of these attachment points here. And most people will feel that pain right in between this area or going down their leg. That's because some of these muscles will compress the nerves that come out of the spine right here and down the leg. And so those are the most common things that people will come in for with complaints. So our goal is to make sure we're not losing these curves first as a preventative measure so that we're not having these huge flare-ups happen. That's my advice.